Hi, my name is Miriam Armour, and I have chosen to focus my topic on trauma, in particular the element of intervention. For the purposes of my presentation, I will focus on group attachment-based intervention. I have chosen to base my presentation on a study titled Group Attention-Based Intervention. Firstly, what is trauma? Trauma refers to experiences which are distressing and non-forgetful to an individual, often resulting in anxiety and depression. Often, when one develops symptoms of trauma, it results to problems regarding their behavior, perception, attachment, and cognition. Therefore, intervention needs to be implemented. Gabby was first introduced by John Bowlby's 1990 attachment theory, which emphasizes the importance of parent-child relationship and their development. Group attention-based intervention is a contemporary treatment used by trained professionals for both caregivers and children with multiple adverse childhood experiences, often resulting in trauma. Gabby is based upon two concepts, attachment theory and adverse childhood experience study. Attachment theory refers to the essence of an infant's relationship with their family and primary caregivers and how that relationship impacts on the infant's development. As for the adverse childhood experience study, in this study, a larger questionnaire devising of 10 categories was completed by participants in order to examine the correlation between health risk behaviors within adults. This study found that adults who met 4 out of 10 categories of maltreatment had an increased risk of mental and physical health problems. For the purposes of this study, therapists aim to reduce stress, anxiety, depression, and painful thoughts via mindfulness and therapy as a means of reducing mental illness associated with trauma, which therefore often leads to physical illness. Gabby essentially builds on the concept of both theories mentioned above. Indeed, through combining notions of parent and child relationship coupled with analyzing one's childhood adversaries, this allows trained professionals to provide the most effective intervention known as Gabby. Therefore, Gabby is indeed another body of research and a new body of research, and it could potentially be a successful intervention for future patients. It is hypothesized that by implementing Gabby among children and parents, the challenges associated with trauma will decrease while promoting social, emotional, and cognitive development. It is also hypothesized that trained professionals will better understand the patient's cause of trauma and therefore provide adequate treatment. Participants included a sample of 60 parents and 60 children aged between 0 to 3. Also, pediatricians and child fair employees were also employed. Gabby was delivered within 2 main clinicians and 2 to 6 students who worked as a team. In terms of materials, Adverse Childhood Experience Questionnaire was used, and a diagnostic classification checklist was also used in the study, covering the 10 domains across parent and child relationships. Prior to participation, mothers were required to fill out an Adverse Childhood Experience Questionnaire covering 10 categories of abuse, neglect, and household dysfunction. BMI was also calculated, and these mothers were required to undergo weeks of Gabby training through mindfulness and counseling between caregivers and children. They attended this training 3 times a week for 2 hours over an 8-week period. The results produced show that 68% of mothers did not study further than high school, 10% had been previously imprisoned, and 28% of the mothers were obese or overweight. Furthermore, 70% of the mothers did actually experience major adversities during their childhood, as they were ticking more than 4 of the adverse childhood experience boxes. Table 3 represents the degree to which these trauma-exposed mothers felt challenged and the extent of their current stresses. So prior to the experiment, prior to the study, mothers recorded to feeling 2 or more stresses. However, after the experiment had taken place and after intervention, these stresses were actually reduced to 0 to 2 stresses. The demographic data obtained and childhood experiences of mothers reflect how parents' behavior, current life stresses, and past adversities may affect parent-child interactions. Most of the mothers in the sample were exposed to 4 or more categories of abuse, therefore increasing their risk of physical or mental health issues. These mothers with children aged 0 to 3 had a less effective relationship with their children, while the children had lower rates of ACEs as a result. However, after the 8-week intervention, ACE rates decreased and mothers were more inclined to have a change of mind and consequently wanting to invest more time in their child's relationship. mothers also felt less stressed and wanting to pursue their life goals. Through promoting secure attachment, not only is the parent able to overcome or decrease their stresses and childhood trauma, but their children will also benefit from intervention as parent interaction changes. Through reducing rates of ACEs among mothers, mothers are able to provide better quality parenting to their children while focusing on their child's needs, as demonstrated in this study. This ensures that possible traumatic experiences posed upon parent to child can be reduced and that a repeat of traumatic history does not occur. Thus, this study affirms of the beneficial treatment of GABI in reducing ACEs and traumatic thoughts among mothers while improving parent and child interaction. Indeed, this study provides future professionals with relevant insight into the traumatic world of patients, while also highlighting the importance of GABI. It builds onto the foundation of previous research in a different form, as this study specifically examines a mother and child relationship. Indeed, the findings can be applied to everyday life regarding a traumatized mother and the relationship with her child. Through GABI, analyzing the past history of individuals coupled with examining relationships, professionals are able to help parents rebuild their relationship with their child through activities such as mindfulness, which aim to diffuse stresses, and as shown by this study, do indeed work. Though the study itself does not mention strengths and weaknesses, there are definitely a few that can be noted. One strength of the article is that it is highly controlled form. In particular, parents were screened on the basis of excluding non-birth parents, non-English speaking parents, and children aged 36 months. This was to ensure a reduction in potential bias. A couple of weaknesses of this study include that only female parents participated. Gender differences could affect the outcome of the study, and therefore it is difficult to apply the study to the wider society, particularly those who are not parents. Furthermore, there was no control group to compare with the experimental group. There are a few changes that could be implemented for future research and replication of the study. In particular, there was a wealth of research which covers the mother's history, background, and trauma outcomes. However, there was no data or follow-up in order to assess if treatment continued and that if results continued. Therefore, for future studies, it would be advisable to ensure long-term follow-up is noted. Also, it would be suitable to include both males and females participants and to not limit the study to only females. And to also not limit the study only to families. Therefore, more research is required to analyze GABI within a broader context and broader cohort of participants. In terms of future practices, psychologists should consider implementing GABI within their therapy, particularly around parents and children. GABI may aid a psychologist in trying to understand child adversities and attachment styles of traumatized individuals.